Okay, I'm going to go ahead and perform inserting a indwelling catheter on a male patient. So the first thing I'm going to do is verify the provider's orders. I'm going to make sure that the order is for the indwelling catheter. I'm going to go and introduce myself to the patient and get the name and date of birth. So could you go ahead and tell me your name and date of birth? Okay, it's Marvin Allen and the birthday is 7/11/66. I'm going to assess for allergies. Mr. Allen, are you allergic to shellfish, betadine, or latex? Okay, no, he is not. Next thing I'm going to do is I'm going to prepare the patient. So I'm going to wash my hands, put clean gloves on. I'm going to perform perineal hygiene. So I'm going to go from wipe from inner to outer in a circular motion. I'm going to put the patient in the dorsal recumbent position, so it's easier to insert the catheter. Then I'm going to remove my gloves and wash my hands again. The next thing I'm going to do is I'm going to assess myself to make sure my hair is up, my sleeves are pulled up, and that I don't have anything that will go that will interfere with the sterile field, including my badge and stethoscope and whatnot. All right, so now you are ready to insert the catheter. So I'm going to go ahead and open this up. You want to do it away. Okay. And then I'm just going to touch the outer edges and reposition this. Okay. And then I'm going to take my sterile gloves and just put them right there. And then I'm going to touch the very, very tip of this, go away, and make sure it opens up by itself. And I'm going to lay it between the patient's legs. I need to reposition some stuff here. Okay. All right. Now I'm going to go ahead and put my gloves on. I'm going to crease it to make sure it doesn't fold over. So I'm going to put the glove on my right hand first. So I'm going to grab the cuff on the outside, insert my hand like that. And then I'm going to take this hand and go under that, and I'm going to insert my hand there. Okay, and I can touch up here now. All right. My computer is shutting off. I just need to make it. Okay, and now that I've done that, I'm going to get rid of this paper right here. All right, I'm going to take this and reposition that. This drape, don't need it, get rid of that. This drape, don't need that. He's not allergic to iodine, so I'll get rid of the hydrogen peroxide. Okay, and then I'm going to go ahead and cover the cotton balls with the iodine. Get rid of that. I'm going to put the lubricant in that little section right there and get rid of that. Move this over. I'm going to take this off, and when I'm taking this off, I want to make sure this doesn't flop around. I'm going to coil it up in my hands like that. And then I'm going to go ahead and lubricate that. And I'll place it back, and I'm going to put this, touch the syringe to the catheter. And I'm going to remove this specimen cup. All right, I'm going to put this back on top and move this between the patient's legs. Okay, so I'm going to take my non-dominant hand and grip the penis and retract the foreskin if there is any. And then I'm going to take the cotton ball, go inner outer 1, inner outer 2, inner outer 3. I'm going to drop that, get rid of this tray. Now I'm going to take the lubricated catheter and I'm going to insert it on 3, Mr. Allen. I'm going to insert this. So go ahead and take a deep breath. Ready? 1, 2, 3. Deep breath. Inserting, inserting, inserting all the way to the Y junction, right there. And then I'm going to take my non-dominant hand and stabilize that. I'm going to fill up the balloon. Keep filling it up, keep filling it up, put all the fluid in there. I'm going to detach that, get rid of that, okay. And now that I've done that, I'm going to push it out, make sure there's resistant, and there we go. And then I'm going to remove my gloves and perform hand hygiene, put some clean gloves on and perform perineal care again. And I want to make sure that I document how the procedure went. I want to document if there was any labs. I want to document the color of the urine, how much urine there was, and all of that. And also the reasoning for the catheterization. My computer keeps turning off. And any of that. All right. Oh, and I did forget to mention to position the bag on, or attach the bag to the leg, just so that doesn't come out. I did forget to mention that. It's weird doing it on a bottle instead of a patient. Okay. All right. Well, that is it.